of cases by age group on the next slide, which shows that persons in their 20s and 30s have the greatest number of cases of COVID-19 confirmed. But when we look at the deaths in the next slide, we note that as age increases, the case fatality rate increases, and it is significantly so once you get to 50 years and over. For more females have been diagnosed with confirmed with COVID-19, but when we look at the deaths, more males have been diagnosed, have died of COVID-19. Please, next slide. And next, so more people. When we look at the cases by parish, the cases by parish, so this is our community spread, but the slide before shows us what's happening over time and in the last 2 weeks. If we look at the last two slides, the parishes of KSA and St. Catherine have the highest number of cases, but when we look at the rates, the parishes of St. Thomas, St. Anne, Kingston and St. Andrew have the highest number of cases per population. Next slide. Oh, that's the wrong set. So, okay, can go on. This is the community cases. So this is the cases that have happened over time, and as recently the number of cases have been decreasing, but it seemed to have leveled off just about in the last few days. So this is the cases. When we look at the admissions by time, we note that we have been decreasing over time, and
you want to?
No, Minister, I think we should just pause here and go to the other presentation and correct the slides. The slides seem to be off.
yeah, they are. Yeah.
The slides seem to be off, and
So let's do that.
I think we need to just fix that. So let's proceed, and then we'll go to come back to these slides.
All right. Do you have the presentation of the Blitz on? All right. So I want to apologize for the mess up there. We seem to have had the wrong presentation, but still relevant. And I think Dr. Webster was trying to maneuver what was there. But I think we'll get her back to look at the other aspects of the presentation. In the meantime, I want to take this opportunity to really offer a well-deserved recognition, shout out, if you will, big up, if you will, thanks, congratulations, all the accolades that are familiar to us in recognizing the stellar effort that has been put out by the various stakeholders, starting with our healthcare professionals, the leadership, the level of the ministry, the regional health authorities, the parishes that have really made our Blitz effort, I would say, a success these from Friday of last week to Tuesday, which is yesterday. It was, I think, a sprint for us in public health and a long sprint, not the pace of Usain Bolt, but certainly it required non-stop activity, almost, almost comprising the entire day. Well, after we closed the Blitz sites, the work had to continue in terms of planning, adjusting, correcting. But I think we pulled it off. And I say so in the collective spirit that it is intended or should be intended. We meaning all of us. We pulled it off in achieving the targets that we have set, in surpassing those targets. And that took effort from public health, our nurses, our doctors, from private health who volunteered, from critical stakeholders like the Jamaica Defense Force, the JDF, the Jamaica Constabulary Force, from other critical stakeholders like ODPEM, our members of parliament and councillors, municipal authority, our Minister of Local Government and Rural Development, Desmond McKenzie, Senator Campbell Rodriguez, who helped in the organizing or overseeing on the day, or my own Minister of State, Juliet Cuthbert-Finn, despite her birthday, was out there, and of course the usual team around the table. We had support from the American Friends of Jamaica, who had one location in Hanover. We had support from various sponsors and volunteers. We have, as usual, the location at the Good Samaritan facility at Heroes Circle. And we had the support of over 80,000 Jamaicans who came out and who got inoculated, who got vaccinated, who took the jab, if you will. And I must tell you, despite the efforts, we in public health pulled a lot of energy from the enthusiasm and the participation and the patience and the orderly behavior of those who participated. So I really want to say a big thank you. It was hectic. I mean, I went through about 9 parishes over the 3 or 4 days, but it was a proud moment to see Jamaicans from all walks of life participating in this process for their own benefit, for the benefit of their family and community and country. But nevertheless, it really represented an all hands on deck approach. So for the Blitz, we set ourselves a target of 75,000, but through the hard work of the team and those on the ground and those who took up the offer and came out and participated, we exceeded that target by some 12%. So over the 5-day period, instead of the 75,000 ambitious target we set for ourselves, we actually inoculated some 83,828 Jamaicans. And that deserves an applause. And again, because we all sought to participate. This accounts for some 60% of our overall vaccination to date, the Blitz weekend that is, 60%, which makes these Blitz quite important, quite necessary if we are to achieve the target that we have set for the overall vaccination program. We can reveal too, and these numbers are still being crunched, but this is, I think, as close to accurate as possible, right, PS? I would say it may be subject to change here or there, maybe a margin of error of 1 or 2%. But we can reveal that to date we have inoculated some 135,473 Jamaicans over the period since we have started, representing some 7% of Jamaicans targeted to be vaccinated this year, this financial year. Of course, we have a 1.924 million number to achieve the herd immunity by March of 2022. But 7% over the period of time is not a bad target. And the Blitz weekend demonstrated that Jamaicans are interested and are willing to come out. It also demonstrated when we opened up the categories that some persons were more willing to come when they had company to come. So a younger person taking an older person. These are things, the patterns, the data we are still assessing. But there was a lot that we learned during this first national blitz. And we are now going to use the next few days to assess and to return with an even better plan. So when we get into the next blitz, which we hope will be not this weekend, but maybe the weekend after, we will be in a better position to even make it more efficient. We do appreciate that there were some persons who had to wait for long, meaning a number of hours. We also appreciate that there are persons who had to be turned away. And I want to use this opportunity to personally apologize to those persons who had to be turned away. It clearly would have been an inconvenience to them, and it was not a desirable position for us. It's not something we wanted. But the fact is that the demand was overwhelming, and at some point the vaccines were running low, and we had to calculate to manage the process through to a successful completion. In a sense, it's a good problem to have because it helps us to appreciate what needs to be done next time around. But we understand from a personal perspective, it would have represented some inconvenience. I want to really say that persons were patient for the most part, well behaved, and waited even up to 4 or 5 hours in some instances. And that to me says a lot about our fighting spirit as a people and our willingness to overcome the challenges that we face. In the weeks and days to come, a lot more will be said about the Blitz program and the vaccination program, because there are some deeper issues that I think we will have to analyze, catalog, and present. But the most important statistic right now is the fact that we exceeded the 75,000, achieving 83,828, at 12% over target, and we're now at 135,473, or 7% of our overall target. For the next couple of days, we took a decision that our health team deserves a break from the vaccination program for a couple of reasons. First of all, they're tired. They're tired. I saw persons working on their last, fumes when they had to go to late into the night. I mean, just nonstop. And they deserve a break. They deserve a break. Secondly, so we're going to allow that for this going into this weekend. But secondly, there are other things to do in public health. It's not just about COVID. It is the very same people who have to deal with the cardiovascular cases, the clinic sessions, the diabetes clinic, all the other things that are necessary. And so we committed to this Blitz this weekend at the expense of those other activities. And there are persons there requiring that service too. So we have to go back to some of that. Thirdly, though, I think it's important for us to stop, to take stock, to reflect, to assess what happened, where it did well, where it didn't, and then recalibrate to do better. And fourthly, we also have to allow the process of securing vaccines to be available, or more vaccines to be available. We do have some limited stocks now, and so come Monday, we will begin the process of to inoculate others, but it will be the regular routine phase 1, phase 2 process with the Blitz to come later on. And the next Blitz would have to be influenced by another shipment, which we anticipate we will get in a week under the COVAX program, which we had earlier announced, some 55,000 to come in. So for those reasons, but I would say the real tribute to the healthcare workers, I think they deserve a few days to relax and to reflect we will not have a blitz this weekend. To allow us more details around the blitz and how it, what the data is, some interesting data that I think you'll be interested to see. I'm going to ask Dr. Melody Ennis to make a quick presentation on a dissecting of the numbers to date on the blitz in terms of who actually benefited. Dr. Ennis?
Thank you very much, Minister, and good evening, everyone. Trying to get this on slideshow. Okay, so we're going to look closely at what has been happening over the vaccination period, but certainly focusing on our Blitz operation. So, as Minister mentioned, we are proud to get this on slideshow. Okay, so we're going to look closely at what has been happening over the vaccination period, but certainly focusing on Blitz operation. So over the period, we achieved our maximum inoculations in week 5, which would definitely be the week of our Blitz, exceeding our target by close to 29,000 persons being inoculated. And you will see that April 12 will go down in our history because really in recent memory, it is the largest number of persons in country that has ever been vaccinated. And that was some almost 27,000 persons. So when we zero in now on the Blitz operation, a total of 83,828 persons were vaccinated. We utilized all 75,000 doses of the AstraZeneca vaccine that we received. 60% of the total vaccinations administered to date came over this 5-day period. We continue to have more women being vaccinated. However, the gap is closing. So we have vaccinated 56% females and just about 44% males. When we look at the age range, remember we had started with our elderly over 75, but during the Blitz, we had opened up to persons over 40 with comorbid conditions, and then later even more. But the lion's share of persons who accepted the vaccine fell in the 60 to 69 age range, amounting for some 26% of the population. This was followed by the 50 to 59 with 20% and 40 to 49 with 13%. Of course, Kingston and St. Andrew accounted for most of the persons vaccinated, but the larger parishes held their own and was pretty uniform across the island. So St. Catherine, Manchester, St. James achieved 9%, and not to be outdone was St. Elizabeth and St. Anne. Of course, we expected smaller numbers in the parishes that had a smaller population. So Hanover, Portland, St. Thomas, and based on their population, we do believe that they also did well. If we do a cumulative look at what's been happening, we see that our female to male ratio is pretty stable, 56 females to 44, and the age range is similar, 60 to 69 continues to dominate the quantity of persons that were inoculated. And the parishes are holding their own over time. Now, important is our events that are supposedly attributed to vaccination or immunization. Those are the side effects or the adverse events, and we have been monitoring same over the period. We have received to date 76 notifications, the vast majority coming from females, amounting to 66, and males just 10. it's interesting, and we continue to watch this trend that the younger persons who receive the vaccines are the ones that have the most side effects. So our 18 to 37 group, of that 76, 34 of those persons would have reported having one or more of the side effects, and it was followed by 38 to 57. Our elderly persons over 78, only 3% have reported any adverse effect at all. Now, we also analyze the adverse events, and we categorize some as being serious. Now, what we call serious would be deaths, activities that may be life-threatening, anything that leads to disability. So over the period, we have noted 5 serious reports, 46, no, nothing at all, not serious, and unknown. Unknown is an interesting category because when we assess the reports, we cannot make a determination. It's possible that information is inadequate, so we classify those as unknown. We have had 1 death. Our 2 life-threatening conditions were actually the dreaded anaphylactic reactions. We are happy to report that the patients who will have been classified as sane have recovered and are doing well. We also had 2 hospitalizations, and of course, these persons have been discharged and continue to do well. And we have noted 1 death that continues to be under investigation. Oops, in the wrong direction. All right, we get our reports from parishes, and St. Catherine, Kingston and St. Andrew, Trelawney in the west have sent in the most reports in the ISAVI category. We continue to encourage the teams to send in so that we can have this database and update the nation as frequently as we do. When we look at the target groups, remember we had specific persons that we were focusing on. We all know the elderly and healthcare workers, but we are now looking at our teachers. So of the approximately 18,811 teachers in our country, we have just about vaccinated some 32%. So there's a little way to go with our teachers. We don't have the exact number of tourism or transport workers at this time, but we have vaccinated over 4,000 persons in the tourism sector and over 502 persons in the transport sector. And this is really just a pictogram of the divisions in the various categories. Of course, our elderly continues to take the lion's share, followed by the original groupings, the JDF, JCF, government officials, persons in nursing homes. And I believe I can end here. Thank you so very much. Over to you, Minister.
Dennis, just to emphasize the in terms of the numbers who have benefited from the immunization program to date, it's 44% that are over 60 and over, and if you add the 50s and over, it's 60%. So that in and of itself, I think, is a good indication that we are also reaching the target groups, and that's a very positive thing. So just to emphasize that. Okay, so I think we can go back to Dr. Webster-Carr, who has sorted out her presentation, and just have her quickly just run through. Dr. Webster-Carr?
Yes, thank you, Minister. Good evening again, everybody. We'll just go quickly through the first sets. So on the next slide, we have the number 130 new cases and overall we have 692 deaths with a case fatality rate of 1.6. When we look at the next slide with the age group, the 20 to 29 has the greatest number of cases, followed by the 30 to 39. But in the next slide, the deaths are greater in the over 50. You get significantly more deaths, and as you get older, the case fatality rate increases. On the next slide, the more females have been diagnosed with or confirmed with COVID-19 than males, but when you look at the deaths in the next slide, more males have been have died from COVID-related matters. The parish distribution over the last 2 weeks, parishes with the highest number of cases were Kingston and St. Andrew, St. Catherine, St. Anne, and St. James. But when you look at the rate per population, the number of cases by population, St. Thomas led the way, followed by St. Mary, Kingston and St. Andrew, and St. Anne. Almost all communities have at least confirmed one case. Currently, we still have most communities in Jamaica with cases in the last 2 weeks. When we look at the cases over time, the daily rates, so far, the 8th of March has had the greatest number of cases with onsets on that date. However, over time, the number of cases are decreasing. The pace of decrease has declined a little bit. In this slide that is up, the number of admissions, when we look at in relation to the COVID-19 designated beds, we have in the last 3 days gone below our capacity for the first time in a few weeks. And so we hope that this continues. And of note, on the 11th of April, 40 beds were added at Spanish Town with the field hospital. And so we are hoping that this continues going in this direction. This is the parish distribution of cases, and pretty much the parishes look similar to what's happening nationally. And then on the next slide, we look at the weekly distribution of cases. So let us go through what's on the slides. Firstly, the bed occupancy has decreased over time in the last 2 to 3 weeks. The number of cases has decreased. The number of deaths have decreased, and the positivity rate has decreased. I must point out that the deaths lag behind the cases, at least a week behind the cases. So week 10 had the greatest number of cases, and week 11 had the greatest number of deaths so far. Next slide. When we look at the deaths over time and look at the age, the green represents person over 60 years, and pretty much that has remained the same. This slide would become even of greater importance when we look at the vaccination and we get in the target group. So we'll probably bring this slide back in the coming weeks and months. But when we look at the admissions and relate it to the deaths, for admissions that are at least moderately ill, about 64%, 70% are over 60. But when we look at the deaths, it's about the proportion, about 74, 75% are over 60. So we'll continue to watch how this changes over time. Next slide, please. when we look at the positivity rate, as we mentioned before, the positivity rate, even the corrected one, is decreasing over time. We note that the number of tests have decreased somewhat from about 15,000 on average to about just under 14,000. But the positivity rate continues to go down, which suggests that there is a decrease in cases, because while testing more will give you more positive cases, if you test more, it's likely that the positivity rate would decrease. So this appears to be a true decrease in these rates. When we look at the reproductive rate, currently we're at about 0.9%, which means that it's just less than 1, which suggests that the cases are decreasing over time. So one person would infect on average, less than one person. And so this is where we are, and we hope to bring it down a little bit more. On the next slide, we look at a little closer look at the reproductive rate and what has been happening since the last set of restrictions starting in February 10th. And we note a few things. The reproductive rate related to the confirmed cases has decreased. The reproductive rate associated with hospital admission has decreased, and the positivity rate has decreased. Now, we would want the positivity rate to decrease even further to less than 5%. So this is where we want to go. So it's the right direction, but not yet where we want to be. Next slide. Just to say that we are having this good, or these improvements, but to really get to a very low number, we need to maintain this rate over weeks and months to ensure that we come out of community transmission. So that's my presentation. Thank you very much.
Thank you very much, Dr. Webster-Carr, and very confidently presented presentation. Second time around. Dr. Webster-Carr, a very hard-working epidemiologist. Okay, so we're going to quickly ask the CMO to comment on a very important aspect of the narrative, which needs to be a conversation piece in the weeks and months to come. And this involves the need to ensure that those persons who receive their first dose of the vaccine, one of 2 doses, of course, in the case of the AstraZeneca, for sure, that they appreciate or understand or recognize their role to themselves, their responsibility to their community, their family, their friends, and by extension to the country. Firstly, it's about how do they protect themselves? And in protecting themselves, they must understand that a single dose does not make your resistance, your immunity, your protection guaranteed from the COVID virus. Very, very important that we understand that. In fact, it's important to get the second dose within a period of time to complete the process to give you the maximum protection. Having said that, and in the case of the first dose, it is very important that we observe and maintain the protocols that have been established. Getting the first dose is not an excuse not to wear the mask, not to social distance or physical distance, not to sanitize. Getting the first dose is not justification for deciding that you're going to resume the parties, the gatherings beyond the limits that have been established by the orders that the government, the Prime Minister, announced yesterday. In other words, getting the first dose is not a free paper to do as you like. You still have the burden of responsibility, firstly to yourself, to protect yourself because you are still exposed and can still get the virus and can still be impacted, but also to protect yourself so that you can protect others, because you could have the virus and you can pass it on to others. That's what the science says. And so the message to that 135,000 Jamaicans is that while we are very proud of you, while we commend you for taking that first step, it is not the journey. The journey is to observe the protocols, take the second dose when it is time, and then we will resume some semblance of normalcy once we achieve the herd immunity that we are desirous of achieving. So I'm a layman. I'm asking our clinician now, the chief medical officer, to comment on what next after the first dose.
Okay, so good afternoon, everyone. So you've gotten your first dose of the COVID-19 vaccine. What's next? Next slide. So first of all, just to remind you that AstraZeneca is a highly effective vaccine. The overall efficacy in the initial studies have shown 70% efficacy, which means that you have a 70% reduction in symptomatic disease in persons who have received the vaccine compared to those who have not. And I just put together a little slide to explain what that means. Next slide. So on the left of the slide, if I have 100 persons who have not received vaccines in the dark blue, and I have 100 persons who have been vaccinated, and everybody has been exposed to COVID. In the group that has received no vaccinations, then maybe 90 or so persons could get, let's say that 90 people get COVID. These 90 people that get COVID could either get a mild, moderate, or severe illness. In the group that have gotten vaccinated, 70%, and this is what the efficacy is, 70% less than the persons who got it in the not vaccinated group will get COVID, 70% less. So that if you take the numbers, if it was 90 who got it in the no vaccination group, it's going to be 63 less than that gets it in the vaccinated group. And importantly, the persons who get it in the vaccinated group are going to have a mild disease. They are not going to have severe illness that is going to result in hospitalizations or death. So it's a win-win. It's either you don't get it, or if you get it, it's going to be a mild disease. Next slide. So to remind you that the main aim of the vaccine is to reduce severe illness, hospitalizations, and deaths. It has been shown to be 100% effective in reducing severe illness, hospitalizations, and deaths, as no person who received the vaccine in the studies that were done developed severe disease or died. The vaccine consists of 2 doses, as the minister has said. You are only considered to be fully vaccinated 14 days or thereabouts after your second dose. The protection against COVID-19 increases after the first dose, and it is best after receiving the second dose, approximately 8 to 12 weeks after the first dose. Now, it will go up as high as over 80% efficacy, and it is effective in all age groups over the age of 18. Now, after you've taken the first dose, the protection that you get, this 70-odd% efficacy rate, actually decreases over time. And what some new studies are showing, or reports are showing, is that after 90 to 120 days, you're getting as low as 31% efficacy rate. So there is a considerable decrease in the protection that is afforded
if you do not get the second dose of the vaccine. Now, if you have been exposed to COVID before or after you've had your first dose, some persons will still get COVID. The vaccine does not give you COVID. There's no virus in the vaccine. The symptoms you develop within 24 to 72 hours after is your body reacting to the vaccine. It is not that you're having COVID, or it's not that you're having mild COVID symptoms. It is just your body's reaction to the vaccine. However, remember that we are still in community phase, the community transmission phase, and so many persons around you may have COVID. Now, if you are infected in the first days after the vaccine, you will have no protection from the vaccine, and therefore you may develop a severe illness. Now, after about 2 to 3 weeks with the vaccine on board, and remember, it is not going to prevent everyone from getting COVID. You may get COVID, but if your body has started now to develop some immunity, it will be a mild illness. But it is still possible to transmit COVID to others who may not be vaccinated, and they may get a severe illness. So, therefore, how do you protect yourself in this period? How do you protect others? You need to continue to do the same thing that we have been speaking about all this time. You have to wear your mask, you have to practice physical distancing, you have to hand sanitize, you have to sanitize frequently used areas, you have to stay at home if you are sick, and all the other things that we have said in terms of infection prevention and control. These still are, in fact, that you must do them still, because you can get COVID and you can transmit it. So you must. And then after we have all gotten fully vaccinated, 2 doses on board, a good percentage of the population, 60% of the population vaccinated, then we can get back to life. Thank you.
Well said, CMO. I think that is very clear. And I'd like to say in the days and weeks ahead, we will repeat this narrative. We'll break it down. We'll simplify it where necessary, because it's important, very important information that the country absorbs and recognizes that a single dose of the vaccine does not make 100% protection for you. A single dose gives you, in some respects, a greater responsibility to those around you, your loved ones, your friends, because while you may enjoy some protection, not just in avoiding the virus, but in terms of your response to the virus if you were to get it, may not make you as ill. The reality is you can certainly pass it on to your mother, your aunt, your uncle, your best friend, and they, if they don't have similar protection, could fare much worse than you. The second point is, this to my mind is a justification for you to encourage those around you who have not gotten their vaccine to get it when it is available next and when we announce whether the next blitz or the locations. Because this is a community spirit we have to generate. It's a national drive. It's a national mobilization. It's a national response to a crisis. We all need to be protected for each of us to feel protected. It's a one for all for one type of scenario. It is about protecting all of us, and we are as vulnerable as our weakest individual. And so those who have gotten it, share their experience and encourage others to take it, and also recognize your awesome responsibility to continue to observe the protocols to give those persons protection. And the third point is that the side effects that you have had, and I want the CMO to comment on an element of what was presented earlier by Dr. Ennis. The side effects that you have had, those 135,000, you know, I've had testimonials. I've had the vaccine myself, the first dose. It's not that you have the virus, as the CMO says. That's very important. It is your body building the protection against the virus. And so interpret the side effects as a positive thing, because what it means, it is that it is building your immune system. It is building your capacity to fight the virus. And so an evening, a day, a night of having a joint pain or even a mild fever or even a few chills, you know, you take the Panadol, rest, relax, overcome. You will get back to normality, as all of us have in this room, at this table, who have taken the vaccine, and the 135,000 of us throughout the country. Don't use the side effects to discourage others from taking it. There don't need to be graphic or dramatic. It's a good thing to have some side effects. Don't use the side effects to not take the second dose. Very important, because final point is that, as the CMO said, you lose significant protection over time if you only take one dose. So you become as vulnerable as you are, or almost, in 3, 4, 5 months if the second dose is not applied. To achieve the full protection, you need the second dose. So let's be brave and bold, and let's make that commitment. We will begin to start scheduling second doses in early May, the first week in May, and we are managing that process to ensure that others will get, those who need to get it at that time. I say to those who have had it, let the first jab be your second bold move. The first bold move will come second when you get the second jab. I know that makes sense? Almost, right? I know, it sounds self-contradictory, but I'm trying to emphasize, for emphasis. All right, now, there was Dr. Ennis made a comment in her presentation around a possible death, and I want the CMO to clarify that, because I don't want it to be misconstrued. CMO?
Right. Thank you, Minister. So I certainly want to remind us that we are seeing that the vaccine is 100% effective against severe illness, hospitalizations, and deaths. Over time, though, as more and more persons become vaccinated, you will have persons that there will be deaths that are resulting from other causes. And so, especially as we vaccinate persons who have several comorbidities, persons that are advanced in age, the COVID vaccine will not protect you from other things, other illnesses that you have. It will not prevent you from getting a heart attack. It will not prevent you from getting a stroke. It will not prevent you from meeting in a motor vehicle accident. So there are several other things that will cause death. Now, we know that we are asking persons to report when anything happens to you after you have gotten the vaccine. And certainly we have seen in the UK, in terms of their reports, that having vaccinated over 32 million persons, they would have reported for the period the 9th of December to the 28th of March that 126,000 persons would have died within 28 days of getting the vaccine. Now, we know that there's an older population. They have been emphasizing their older age groups, and so we do expect. But there have been no relation between the COVID vaccine and the persons that have died. Also in the US, we would have seen that the CDC, having vaccinated over 189 million persons up until April the 12th, would have reported 3,005 deaths that would have occurred after. And I have seen in the media, I've seen on social media where people are trying to pass this off to say that these deaths are because persons have gotten the vaccine. This is not so. there has been no detected patterns in the cause of death that would indicate any kind of safety problem with the vaccine having caused those deaths. So I am going to, say that we will be transparent in our reporting, and all the reports that have been made to us, we will report them. And so if we have persons that would have died after getting the vaccine, then we will report it. If we've had persons who have had severe problems after getting the vaccine, then we will report it. This is how we analyze information. We look at patterns right across the world, because these reports are submitted to the global committee that monitors these to see if there's any kind of relationship. But there has been no association between these cause of death found with COVID-19. So the vaccine is safe, it is effective, and I would encourage everyone to get their doses of the vaccine.
Thank you very much, CMO, and I thought that was very necessary, the clarity. And so we say to Jamaicans, no need to panic or to be concerned. Let's go get that vaccine once it's available. And again, commendations to those who have. So in regards to those who have taken the vaccine, we have 2 quick interviews that we felt would be necessary to hearing from persons who have to share their experience of the Blitz. There are some persons who said, boy, they expected a nightmare, they expected chaos, but when they came, it was a different experience. Some may not be as pleasant. There are aspects of it that we have to adjust. But I would love to invite now Ms. Thompson, Kiodi Thompson, to share her experience. She is a realtor and works in Kingston, and she represents one of the younger cohort at 30 years old. And is she online? Good. Oh, she's online for sure. Hello, Ms. Thompson. How are you?
I am good. Thank you, Dr. Tufton. And thanks for saying I'm in the younger cohort. I'm actually 36.
Oh, well, my brief here is wrong, but I could easily say you're 25 or 21, actually. So
Thank you
that's
very
good, too.
much for that. Thank
All
you.
right. So you received the vaccine. Where did you get the
I
dose?
had my first jab at the arena on Sunday.
Okay, and that's the record-breaking day when the numbers were quite high. How did you find the experience?
Well, I was there overall for 3 hours, but I would say that the experience, it was a bit of a wait, but that is to be expected. What I was very impressed by is the organization that took place. The JDF, they were there coordinating things constantly. They were updating us as to what was happening or what would be happening next. We got the forms to complete while we were in the line, and that was very impressive. Like I said, it was a bit of a wait, but there were a lot of persons, and you have to make time for what's important, and there's nothing more important than this right now.
That's well said. How did you actually find it? Did you find that you got enough information, the technical information now, around before there's a counseling session, if you will? I know it was done in groups. How did you find that?
Yes, so once we got inside the arena, we were given a counseling session, which is done by grouping. And they told us what to expect in getting the first vaccination, the first jab. They told us about possible side effects. They told us about taking Panadol 500 if we had any symptoms, and the importance of coming back to get the second jab because the vaccination process is not complete without the second jab. So outside of the public campaign that the ministry has been doing, we were all made aware of the side effects. So to be honest, when I had side effects, I wasn't surprised because I expected it,
I was actually going there next.
That was
I was actually going there next. So how did you deal with the side effects? And you said you expected it, so that's good. But how was it?
First, let me comment on the jab for those who are afraid of needles. So am I.
Okay.
I had to ask the lady, the nurse, if she was finished because I barely felt anything, to be honest with you. So do not be intimidated by that. The side effects on Monday, I had fatigue, a mild, well, I had a headache. I had some chills. And to be honest, I felt like a bus ran over me that day. I just did not feel good. But I took the Panadol, I rested. And the next day, being yesterday, Tuesday, I was fine. I went to the gym and I lifted weights. So it's the side effects are temporary. It's a day off from work, but it's important. And there's nothing that I experienced which was important that I was not made aware of before. So when it was happening, I was like, okay, they told me. Plus other persons I knew who had taken it before told me they had chills. I'm like, okay. So as the things are happening, so people just have to make sure that they're abreast of accurate information before they go in and not be alarmed, you know. Every medication has side effects.
Right. Well, you just gave another incentive to get the dose, the day off, which we're not promoting here, but employers, I'm sure, may want to offer some flexibility.
With one day off, we can go back to full capacity,
Well,
which is like
you're justifying the reasons more and more, so I'm sure the employers are listening. But thank you very much. We appreciate your coming on, and we are saying that the vaccine is available for all age groups over 18, I think it is. Is it 18? And the intention is over time to provide as many dosage as possible for that for the cohorts to achieve it. And did you encourage or come with anyone? Did you bring any older person or?
I did not come with the older person. I actually came with my spouse, but my mother, I took her to be vaccinated in the week, but she was not able to, so I'm going to take her in the next Blitz because she lives in St. Elizabeth.
Okay.
But I was there with my spouse, so we both got it and it was fine. And I just want to say, I want to encourage everybody to get the vaccine. The truth is, people cannot keep complaining about the restrictions and not participate in the solution. I find that very intolerable to hear people complaining when they hear the restrictions. And at the same time, the same people are saying they're not going to take the vaccine so that we can get back to normal. And to me, that doesn't make any sense. You have to participate in the solution.
Thank you very much.
Because complaining is only you're only supporting the problem even more.
Appreciate those words, wise words. Thank you, Ms. Thompson. We appreciate it, and thanks for coming on and giving your account of what took place. Thank you.
You're welcome.
All right, so the next person, I don't know if we have him online as yet. Oh, yes, we do. And he's not so unfamiliar, to be totally frank. I never knew I'd get the chance to be interrogating him, given that he likes to interrogate us. Mr. Damian Mitchell of the Gleaner RJR Communication Group. So I'm assuming, sir, that you took the vaccine and you're alive. Not hearing you. Is your mic off? Having some difficulties with the sound. Still not hearing. Is it from here or? Check your system, Damian, to see if it's. Is it still not hearing? Two? Unmute. You're unmuted. Just check to see if you're on mute or. All right, so we're having an issue there. So I'm going to ask you to just maybe try again, see if there's an issue with the. You know, one of the challenges that we thought we would have faced when we were. Are you now?
Yes.
I'm all right, great. So you had a little issue there. So thank you for coming on board. We wanted to get your experience of the Blitz weekend, where you got vaccinated, and how was the experience?
Well, I was at the National Arena. It went fairly smoothly inside. I was pointing out to some of the members of your association, your organization, I beg your pardon, that in respect of the logistics, I think the soldiers did extremely well on the outside. They were very coordinated. and it was very clear what the process would have been on the outside. We waited a bit inside, and I think to some extent I was in the back quadrant, and I think to some extent there was a little bit of a miss-up in respect of the order in which people would have been vaccinated. But overall, I found that the health team was really impressive. I mean, my attendant was Amoy Allen, and she introduced herself, and she was very, very, very pleasant. I found that quite impressive. The information that you were being given also was very useful, and I found that your health team did a pretty good job in to be commended for that.
Are you one who fear needles or not really?
Ah, boy, I don't think I generally fear needles, but this one stung me a bit.
Okay.
There was a little sting there, but I had ensured that before receiving the vaccine, I had taken my 2 Panadols.
Okay.
And then probably about 4 or 5 hours after, I also took some more.
Mm-hmm.
And then I got up in the night to take another dose after about another 5-6 hours. And that was fine for the first day. The second day, I was pretty much okay until later in the evening, I began to feel really tired and unusually tired.
Mm-hmm.
Tired to the point I never even wanted to eat.
Mm-hmm.
But I realized that I did not take any Panadol on day 2. And so I did take 2 more. And I had a very good night's rest, and I was up and ready the next day.
So not much side effects then, basically, you're saying?
No.
Not much side effects. Were you able to influence anyone, any older person in the population? I mean, did you go with anyone?
I tried to and unsuccessfully so. But I think some of my peers, they also took the vaccine. I don't think there was a lot of hand-wringing that needed to have happened. I think the information provided and the benefits and the use of the vaccine pretty much were enough for them to take the decision. So the short answer to your question is no, I never managed to influence anyone to go to take the vaccine.
Right.
Those who went did so on their own volition. There were some of my friends who went had some amount of reservation. I think the question had to be asked, okay, fine, what are going to be the side effects? And then you have to balance what you've been hearing through the unofficial channels with what you've been hearing through the official channels, because whether or not you like it, what's going on in the unofficial circles are having an impact, and they are influencing people's decision on whether they should take this vaccine. So I think people had to make that determination. But for myself, I mean, I think about my own children and the fact that I take them to get their vaccines, and I've not seen anything unusual happening to them except a little fever probably on the first day that they take the vaccine, and you give them some Panadol syrup, and by tomorrow they're up and running again. So those were some of the considerations I had. So
my final question would be, and maybe I'm setting myself up here, but you follow the news clearly. That's your work. If you were to say what of the process that could be improved or enhanced to make it more efficient and effective, both not just in the application of the vaccine, but in getting people out to want to take it, what do you think you would recommend or add to what is being done? Big question.
I'm sorry, just ask that question again. I'm not hearing you too clearly.
Oh, I was saying, what if anything would you recommend to encourage more Jamaicans to take the vaccine, not just to, convince more Jamaicans to overcome vaccine hesitancy? What else can we do?
I think what's most important is information, and information in a way that people can understand it. So yes, you do have a very efficient technical team, but are they communicating? In other words, are the messages that they are preparing being understood for the target markets? I think that has to be the key position, and you really have to ensure that you are responding to, as I've said before, the unofficial narrative which is there. People are putting a substance in their body. They want to ensure that it will not harm them. And I think to a great extent, once the information is out there and the information is verified, then people will be more accepting of the vaccines which are being provided.
Great. Well, thank you very much, Damian. Appreciate it. I'm sure you're going to hang online there because questions now from so you may be switching caps. But we really appreciate your participating in the process and encouraging others, and that for the most part you found the process smooth, and we'll certainly take up your advice on trying to maintain an effective communication program. Thanks a lot. Appreciate it.
Welcome.
All right, Petre, your time. Let's see who is online and what the questions are.
Right. At this point, we open the floor for questions and invite our media partners to use the raised hand feature to be acknowledged. Our first question this evening goes to Janet Silvera of the Gleno. Janet, go ahead.
Thank you, Peter. My question is in relation to the deaths. I'd like to find out what age group the person who died, what area, if it's what parish rather, and what was the symptom.
All right, so this death is still being investigated, Janet, and we don't have all the information. I don't want to share some of the information with you. I mean, it was a very popular case in the news, and a lot of information has been out there already. But from our point, once we have gotten, I have said in the last press brief that we are waiting the case reports from one of the hospitals. And so I'm going to just ask you to be patient. And once we have gotten all the information, then we will share it.
You would be able to say what age group?
I don't have it offhand, but I'm sure if you check past media reports, you would see it in there.
Oh.
Our next question comes to us from Althea Saunders. Go ahead, Althea.
Hi, good evening. I just wanted to ask Dr. Ennis to go over the section about the 5 serious adverse events. I wasn't understanding the breakdown in terms of the numbers. If you could just clarify that for me.
Thank you very much. So when we look at serious reports, we look at hospitalization. We also look at deaths as indicated by our CMO, and we look at disability. So we had 5 persons who would have been in that grouping. So 1 would have been the death, 2 would have been severe allergic reactions. That's 3. 1 person would have had severe muscle pain and would be immobilized for about 24 to 36 hours. And the 5th and final person also had an allergic reaction. However, was just observed in hospital and not admitted. So that's the breakdown of the persons that we have categorized as being serious.
Well, all right, go on to the next question.
Thank you, Dr. Ennis. Our next question goes to Zara Burton. Zara, please go ahead.
Good night, everybody. My question relates to, well, I have several questions. One is about the death. CMO, you mentioned that once the doctor's report comes in, you'll give us a sense of what really went down. I just want to get a sense in clear terms. The 1 death, if it is the vaccine that contributed to the death in any way, will the ministry make a commitment to let us know that, right? That 1 death that you're speaking about. If you're a drug addict, this is the second question. If you're a drug addict, do you recommend taking the vaccine? And if you have drugs in your system, that's 2. There's a fear about AstraZeneca, especially now that J&J's vaccine that's built on the same platform also saw 6 females experience blood clots, and of course that's being investigated abroad. The question I have is, what is the ministry doing for those people who may not be anti-vaxxers? What's the ministry doing to answer the call or the concerns that they just don't want to take the AstraZeneca vaccine? And last question. CDC says if you have COVID, you shouldn't get vaccinated, active COVID. Are you guys making that very clear to individuals that if they think they have COVID or if they suspect that they've come in, just public information wise, are you guys publicizing that part of it? That's it. Oh, sorry. One more question, please. So sorry. On the death, if it is that the vaccine eventually is found to have contributed in any way to the death, I wanted to find out, compensation-wise, will the government have to be compensating that individual? How will that person get compensated? And even the 5 severe adverse reactions, did the government have to cover any kind of costs related to those individuals, and to what extent, if yes?
All right, so certainly in terms of persons who have COVID or who have symptoms that could possibly be related to COVID. So we do have a questionnaire that we ask persons to fill out before they get the vaccine. And so if persons have COVID or have had COVID, then we would want to ensure that these persons, they have completed their 14 days of their isolation period, and that they are in fact asymptomatic at this time and would have had at least 3 days that they are symptom free. So we do question persons in terms of symptoms, and if it is that we believe that the persons may be, there is the risk that they may have COVID, active COVID, then we would ask them to wait until they are over their symptoms before they come back for their vaccine. In terms of the evaluation of and investigation of the death, again, I would not want to make any comment on this until we have all the information and we are able to answer all of those questions. Certainly, things will evolve. Whatever situation that we come upon, we will certainly have to respond, and we will do that to the best of our capabilities. What was it? Okay.
All right, good evening. The matter of compensation for persons who would have had severe or severe outcomes from vaccination. As you know, we already signed the indemnity agreement for the manufacturers, and the government has taken full responsibility for the effects of vaccination within the country. So yes, we would, once it is determined that the ill effect is a cause of vaccination, the government would then go through the process of determining through the legal avenue the levels of compensation that would accrue to the family or the individual. However, I must, from an administrative perspective on this matter, state categorically that as at this point in time, there are no deaths that have been linked to vaccination, none whatsoever. And therefore, the government at this point in time is not in the process or has not activated any of its legislative or legal arrangements for compensation. Again, I wish to state categorically at this time that there is no recorded death that is attributable to vaccination. What we do have is as an indication that there is a case that is suspected. And so I want to make that from an administrative perspective, just for the purposes of the bureaucracy, that we understand that at this time, the Ministry of Health and Wellness is not processing any transaction related to the death of any individual as a function of vaccination.
Next question.
Thank you, CMO. Thank you, PS. We have two questions coming in from Debbie and Wright of RGR. The first, what strategies will the ministry be using to reach more of the priority groups, including the elderly, etc.? And two, she's interested in an update on the payment deductions from SARA workers. Specifically, have those payments been made?
So the payment for the SARA workers, I am advised reliably in a meeting that I had with the chairman and the acting regional director for SARA, that these payments will be settled this week. As the Ministry of Health and Wellness will be transferring additional funds to the Southeast Regional Health Authority to accommodate the additional payments that need to be made, and we will be supporting them to the tune of some $300 million so as to settle the outstanding amounts.
On the issue of the strategies for the older population, I think the more we get into dealing with the outreach at the community level, firstly with institutions, the infirmaries, the nursing homes, and then through our various health centers involving our public health nurses who are in the communities, our community health aides, which we have increased the numbers on, and then teaming up with various organizations, the church, the NGOs at the level of the community. We are going to achieve more targeted intervention in identifying those persons. I will say that the members of parliament and councillors, the elected government officials who participated in the last weekend's Blitz, played a very important role, to my mind, in identifying persons at the community level, particularly those who are not of the means to transport themselves or have caregivers who can transport them to and from. And through their organization, the members of parliament and the councillors, with the supporting leadership from Minister Desmond McKenzie, my colleague Minister Juliet Cuthbert, and Senator Campbell Rodriguez, we were able, I think, to increase our numbers because they organized the transportation, they identified the people, they provided refreshments in some instances for them. They basically took control of them and brought them to the location and brought them back. And this is why it's so important for us to see this as a national effort that involves everyone. And once we buy into it in that way, I think we will achieve more in terms of reaching all concerned. This past weekend's Blitz, to my mind, created a level of equal access that is critical to our vaccine plan, in that you don't have to own a car or have a driver or be able to charter a car and pay to access the vaccine sites and the vaccines that are available. Those who have it clearly would have been at a natural advantage once they desire it. Those who don't would have been at a disadvantage. And what we have been able to do by tapping into the local organizations, whether they political or otherwise, NGOs, the church, is to reach all socioeconomic groups. And that is so fundamentally important because national equity is a critical part of the program in order to ensure that we respond effectively to all of us, all populations.
Thank you, PS. Thank you, Minister. The next question goes to Damian Mitchell. Damian, go ahead.
Thank you. I just wanted to find out from the Minister two issues. How satisfied are you that there had been no further skipping of the line for the vaccine as directed by the Prime Minister? That's question one. And the second question is in relation to the grant for the elderly. I mean, with so many of the people who are in that category being left out of the vaccination during the Blitz, will you now be reconsidering that grant, which is conditional on their getting the vaccine?
Okay, so on the first question of persons, quote unquote, skipping the line, I think increasingly that is going to become not as important. You would have noted that we adjusted the categories over that 5-day weekend, 5-day blitz, as we discerned on an almost hourly basis, day to day, that the numbers were not coming in as we would like because we had a target. And in fairness, all persons are entitled to have the vaccines once they fall in the age category, over 18. So it's a matter of how you schedule and the management of that process. So we took a very simple position. We're opening up to in order of priority, but that priority should not delay indefinitely others from accessing. And we ended up the last 2 days essentially taking most persons, even though we started off with teachers, hotel workers, over 60s, and the other groups that were there before. We ended up going down to 50, and then to persons with comorbidities, and then to other groups, because we felt that it was necessary to get the numbers, and it also was a teaching moment for us to appreciate and understand where the enthusiasm was and how we would adjust as we go along. So I'm not particularly disturbed by any possibility that persons were there who should not have been, because at one point we welcomed all to be there. But the data will also show that 60% of those who have benefited from the vaccines are 50 years and over, 44% 60 and over. So the truth is, the majority of those who have benefited to date are persons who would fall in that priority category, particularly if you add to that number and percentage the nurses, the doctors, the army, the police force, who would primarily be younger persons. So chances are that priority group would be closer to 70% than to the 60, which is for the over 50s, if you were to add those numbers who are younger people. So I think we're getting there, Damian, and I think this weekend contributed a lot in terms of knowledge, even while we achieved the numbers that we set out. The issue of the incentive program, from a policy perspective, it's not. I have had no discussion. The cabinet certainly hasn't, as it relates to possibility of change. From an implementation perspective, I think the PS may be better suited to comment on that, given that he is the chief accounting officer, and I suspect he will work closely with the Ministry of Finance and his counterpart to implement.
So thank you very much, Minister. So we will be having a meeting with the Ministry of Finance and the Public Service on Monday of next week to discuss the implementation of the program. Once we have had that discussion in terms of the link between what are the conditions, so it is being treated like a conditional cash transfer, similar to PATH, in terms of a sort of incentive for a particular social behavior that you are interested in motivating persons to do. And so we will have that meeting next week, and our next conversation, we will give all the details in terms of the rollout of that aspects of the vaccination implementation program.
One final question. Is there an electronic database to reconcile the records of those who would have been vaccinated?
Yes, there is. Yes, there is. There is a database. So the database has two components to it. It has the registration component that you would have already interacted with and interfaced with, and then it has a tracking and the tracking component to it in terms of matching the individual person to the actual vial, the individual dose that the person receives, so that you can follow and do the monitoring of persons once if there's any adverse outcome for any of the vials that would have been administered over time. So the database is component. The first component is in place. We'll be rolling out the second component next week sometime, and for the next set of Blitz, the entire MIS system will be in place to complete the transaction.
And who manages this database?
That's the fifth question, Damian, but okay, let's do that quickly.
So recall that we did sign an agreement with UNICEF, and UNICEF is our counterpart agency in the implementation of the MIS system for vaccination.
Okay. Thank you, Minister. Thank you, PS. That is all the time we have for questions this evening. I now hand over to Minister for his closing remarks.
Okay, so we've gone on for a bit this evening, so I want to use the opportunity to thank all who have come on. Thanks to the presentations, the presenters who made presentations earlier. Just to reiterate, I want to, firstly mention special thanks to the major associations that helped with the mobilization on the Blitz this past week, the JHTA, the Jamaica Hotel and Tourist Association, President Reed and his team, the Minister of Tourism, Ed Bartlett. We were out in Montego Bay together. The JTA, the Jamaica Teachers Association, the president who I saw at the arena getting his own vaccination, and the executive body there. We worked with those groups to help to mobilize their respective members, and I want to say thanks to them because they played an important part. I would like to also say again thanks to all the others who were part of this process. The takeaway this evening is that all things are possible if we work at it. This is a national initiative. We all have to play a role, and it's important to recognize that when we do, we get the results that benefits all of us, and that's so important. Secondly, we are making progress. We're making progress in managing the spread. The Prime Minister announced in Parliament a series of measures, some relaxing of some of those measures. So it's now up to, is it 4 on Saturday? We will put it up on the website. I don't have all the information here, but Saturdays and Sundays now is allowing for some flexibility, and Fridays we go up Monday to Friday until 8 p.m. To 5 a.m. And then there are some other adjustments. So brief yourselves on those adjustments. But I'm sure you would have heard him emphasizing the need for the masks, the physical distancing, the sanitizing. And I want to say to that 135,000 so far to date who have gotten the first dose of the vaccine, please still respect the protocol. You have some protection, but not the protection that you deserve or would like. You have to also protect others because you can still transmit the virus. And let's plan for the second dose when that time comes, because that is what will make you, place you in a better position. It's about getting back to life, getting back to normality. We are on our way. Let us keep hope alive and work together in this COVID response for all of us, Jamaica. Thank you very much.
born in Jamaica here. I'm 86 now. I'm pleased to be in my country getting the treatment for the COVID. Never before in the history of mankind has so much been done by so few for so many. Congratulations to Mr. Tufton and his government.
My name is June Spence, and I've just had my vaccination, and it was a painless procedure. The whole event has been very well organized, and everybody has been very kind and thoughtful and helpful.
No problem. It was very smooth and cool. I think they should take it because like it's essential. So I think it's a very good reason to take it. And no pain, no problem.
Well, it's all right to me. I don't feel no way. I don't feel anything yet.
It was okay. It's not different from any other stick I've gotten. It's not painful. And if I have taken it, I think everybody else should.
Very good, very, very good. I'm encouraging everyone who is afraid to come and take it. No problem. It's very good and easy.
would advise all others to come and take the vaccine, because God could have ended it. And because it is here, he had made it possible and gave man wisdom what to do. And if we are obedient, we will survive. Let us be obedient, and one thing I especially ask, that we love one another.